thank you everyone for joining us today at the Misinformation in Medicine Summit 2022. First things first, I want to apologize for my not so pleasant voice if it is not kind to your ears at the moment. It's courtesy the virus that refuses to leave us. Another thing that has been as obstinate as the virus is the whirlwind of misinformation about the pandemic, the vaccines, the cures, the treatment, and everything associated with it. Before we get on to the panel discussion on this very important subject of addressing the challenges and opportunities in addressing health misinformation, I would like to first take a moment to introduce our panelists for today. We have Dr. R. Kishore Kumar, who is the founder chairman of Cloudnine Group of Hospitals in India. He's a healthcare delivery graduate from Harvard Business School and a world renowned neonatologist who has worked across North America, the UK, Australia, and Asia. Second, we have Sandra Varaidzo Machiri. I hope I haven't mangled your name, Sandra. She's a health communication specialist from the African Field Epidemiology Network in Zimbabwe. She has done her master's in public health, majoring in health promotion from the University of Zimbabwe. Thank you so much for joining us today and agreeing to share your experiences of working in the African region. Next up, we have Dr. Nicola Simon, who is a biologist and a WHO certified infodemic manager. He's also a proud member of First Check, and he's been very active an active participant in debunking health-related misinformation on social media. Thank you, Dr. Nicola, for joining us today. And finally, we have Liz Rimban, who is the Executive Director of the Asian Center for Journalism at Philippines. She's a veteran, award-winning investigative journalist and a journalism teacher. Thank you all for joining us today. And now that the stage is set and I have my panelists ready with me, let's get to the heart of the matter right away. Health misinformation basically is false, inaccurate, misleading information according to the best available evidence at the time. And many of us would like to believe that it started with the pandemic, but that's not quite true. It's not a recent phenomenon. In the late 1990s, we have had the MMR vaccine and theories about it causing autism, which has been plaguing the vaccination scenario for many decades. Similarly, even with treatments, there are many lifestyle diseases, like cancer, for example. People refuse to avail of scientific treatments because they believe in alternative cures or home remedies, and a lot of it is based on misinformation. So while misinformation in health may not be a new phenomenon, there's definitely something that's changed. Today, it has become a part of the mainstream discourse. So my question to each of our esteemed panelists today is this: what do you think has changed, and what are the key health misinformation narratives from your region? Dr. Kishore, if I could start with you, please.
Thank you, Jisha, and really appreciate for having us this afternoon. I think you are absolutely right. The misinformation has always been there, but the pandemic probably made misinformation and disinformation. Disinformation is something misinformation spread with a motive, whereas misinformation sometimes can be spread without any motive. In India, we certainly had a lot of misinformation uh, circulated, starting from mRNA vaccine is much superior than the local vaccine, and then we had circulation of information suggesting that autopsies were done in Italy with the first wave, and that showed the lungs were infected with bacteria, and it's not a virus. The misinformation was so strong, even the government started giving antibiotics for affected patients in the form of doxycycline and azithromycin in their packages. So certainly misinformation was so much prevalent, and the common man with the available social media did not know which one to believe and which one not to believe. And to the extent that I'm sure all of you are aware, hydroxychloroquine, which was being manufactured in India and exported to other countries, was out of stock, and many people who had rheumatoid disorders could not get the hydroxychloroquine at one stage. Then came the ivermectin, and ivermectin, sorry, they said if you take this, you are cured of COVID disease. So the amount of misinformation that was circulated in India is beyond anybody's imagination. And you talked about the MMR vaccine, and in fact, MMR vaccine was also incriminated in COVID. They said if you take MMR vaccine, you're unlikely to get COVID. So there were a lot of people, adults, who came and started asking MMR vaccine for us. Similarly, the BCG vaccine, because India got the first wave a little bit late, they said that's because BCG has been given in India, nobody is getting affected. So the amount of misinformation circulated in media was huge, and it's very, very difficult to control that misinformation. Back to you, Jisha.
Sandra, is there a similar narrative that you see in the African region?
Thank you, Jisha. I'm so excited to be part of this panel today. And I think just as Dr. Kishore mentioned that there's a lot of misinformation that's been going around, and it's been the same situation within the Afro region. And you think things are a bit different because we've had outbreaks since time immemorial. So like every year, there's a country that has a certain outbreak, from Ebola to cholera, typhoid, all sorts of things. And you think by now we've learned better to actually trust health communicators in terms of getting information. But still, we have a lot of theories that come through. And especially now with COVID-19, because it has affected the whole population. So it's like everyone has been affected or infected in some way. And at the end of the day, everyone has a theory of some sort. So within the Afro region, people think that people want to do away with the Black community, Black population. We want to make sure that we've wiped them off. That's why we're bringing in COVID-19 to Africa. We're bringing in the vaccines. So there are a lot of theories around people worrying about being extinct in some way, one way or the other, after taking the vaccine. Or even if we don't take the vaccine, I get COVID-19. If I get sick, it's my time to die. So it's okay. And we also have a lot of religious connotations that have come in, a lot of political connotations that have come in. So it's really widespread in terms of the misinformation that's available. And now, whilst we're encouraging people to take the first dose, the second dose, and in other countries, the third dose of the vaccine, there's complaints about why are we getting the booster vaccine? If it really works, then it should have worked within the first or the second dose. But then we forget that we've had the expanded program on immunization that's been there since time immemorial, where the children get vaccinated, they get booster shots. It's okay if we give the children vaccines, but when it comes to giving the adults the vaccines, then it's something else. So I think the misinformation is still there. We have a long way to go. And yeah, so I think there's similar situations to what's happening in India as well. Over to you, Jisha.
Nicola, are the adults in Italy just as confused and just as clueless about what's happening?
European situation is quite different due to the different amount of population on each nation, due to different political choices for each nation. So also there are problems about age of average age of population. As you probably know, Italy is the eldest average age population in the world, except Japan. So we experienced a lot of death and seriously ill people about middle to elder age range. With this variant Omicron, we are experiencing a peculiar gap of perception because there are a lot of people, of middle-aged people, who fell ill without any symptom, and so they say, "See, it's not a serious illness." While other people are having really serious symptoms, and our intensive care units are getting full day by day, and so there is a gap of perception, because if you don't see it, it doesn't happen. and it is very difficult to communicate that. Moreover, we have a problem because at a regional, local level, most of the health worker and first responders are busy on the front line fighting the disease, and they are not involved into communication. So I'm working a lot. Thanks to I want to thank firstcheck.in to give me the opportunity to join the group and to do my job at the best. And it also helped me to reach many people, such as local religious leaders that knew me from the firstcheck.in fact-checking speaking. They contacted me, for example, because they were reached by some worshippers asking about the presence of human fetus cells on vaccines. And those Catholic priests didn't know how to answer. So they reached me and say, please come to the church and speak to the people. And
Yes,
this is
Dr. Nicola, we will get to the social media because that is a completely different beast, and how we feed it and how we deal with it. But can I just go over to Liz for a moment? We'll come back to you for the social media.
okay.
Liz, since you have been an investigative journalist and you are the master of dealing with such complex issues, how do you deal with this, and how do you inspire and empower children and our future journalists who you are training all the time to deal with this? When you don't have all the answers, how do you communicate?
You know, Jisha, one of the things that we at the Asian Center for Journalism is to create a community of like-minded people who are fighting misinformation and disinformation. So for the past 2 years, we've had a campaign on misinformation and disinformation. We've been working on with universities, other universities, on workshops, organized conferences, generating public awareness and gaining a deeper understanding of the problem is being done through forums like this and research, which helps us understand the problem. The problems are so many, especially because they're of the prevalence of private chat groups where all of these misinformation narratives are festering. So we're very happy to have an opportunity like this to share stories, trends, and actions being done in different parts of the world. For example, Sayed Nasakat, an alumnus of the Ateneo, has done great work on combating misinformation on data journalism and investigative reporting. And it's great that every so often we have events like this where we can share stories and find out that, the stories are the same. So ivermectin in India, the same in the Philippines. We had that problem. People thinking that, it's the cure. Myself, I had that kind of a problem in a chat group that I was with. A family member actually bought boxes of ivermectin and distributed it to family members. And then for a time, people thought that it was an accepted cure. And fact-checking groups now had to debunk this and had to go out and tell people that no, there's been no findings on ivermectin and it's not an official cure. So the fact-checking groups have to be really active on this.
I hear you. And while all four of you all have raised some interesting points, would it be wrong for me to say that we all, in a large part, attribute this to the rapidly changing information environment that we are in currently today, that helps the spread of this misinformation at an unprecedented speed and scale, thanks to social media? So there is a lot of things that's happening on social media. And like you mentioned, Dr. Nicola, there are religious leaders who are reaching out to you based on what you put out on social media. So tell me, do you have to be social media savvy in order to combat this? Is it a challenge, that something that you all have faced? Is it possible for me to say I'm not on social media, so I do not react to this misinformation on social media? How do you do it, Sandra?
So in as much as we focus on the online platforms, I think within the Afro region, our internet penetration is not the best. So we really need to also focus on the offline misinformation that's happening. So we need to strike a balance between the social listening that's done online and the social listening that's done offline. But the offline has been very difficult because of the restrictions that are in place due to COVID-19. You're not able to have that face-to-face interface with a lot of people. So at the end of the day, that platform becomes a bit redundant because we can't really get much information from there. But it's as important as the online platform as well. So I think the challenges that we've faced in terms of trying to listen to what's happening on both platforms is that we don't really have the capacity to the extent that we are able to actually listen to what's happening in all the social media platforms and as well as offline. So that has been a major challenge. And I think the infodemic management issues have come at the right time because this is where we actually want to make sure that our countries have that capacity to actually listen to what's happening and then provide the informed messaging at the end of the day. So I think we are still somewhere there. We're in the jungle. We're trying to make it out there. So yeah, it's been a challenge. It's been a challenge, but we need to strike a balance at the end of the day.
Dr. Kishore, that's something you do fabulously well. I know you've been striking the balance despite your busy schedule. You're always out there debunking misinformation. And how do you do that? Is it something that takes concerted effort, or is it just something that we all have to do?
Well, to answer your question, I think it does take a concerted effort. When I did my executive MBA in Harvard, one of the things which they insisted on is we have to be in social media as the right people. Otherwise, the wrong information is going to be penetrated. Till that time, I had actually not started using social media at all. If you look, all my accounts is only in the last 3 years. And there's a myth that, Instagram is for youngsters, Snapchat is for youngsters. In fact, last month, you won't believe it, we saw a spike of children who all had swallowed colored magnetic balls because it was a rage in Instagram. And in our one hospital, we saw 10 children requiring gastroscopy and removing the gastric balls. And one of them had to have an intestinal surgery because it had matted and moved on to the intestines. So the misinformation, which makes younger generation to do a lot of things, is spread rapidly in the social media. Unless we are all in counteracting these sort of things, we'll land up losing out and probably mistreating the generation who are on social media. It may be Generation X, it may be Generation Y, it may be Generation Z. And I think the social media has become a necessity for all the right people like us to stop the misinformation and disinformation from being spread. I feel we need to approach this in the four-pronged approach. First is challenge the accuracy of the information which is being spread. Second, we have to verify the misinformation and spread the correct information. Third, which I feel strongly, is punish the originators of misinformation and disinformation and also spreaders without validation of that. And fourth is have a reliable websites which is approved in each country by the government for accurate information where they can verify the information. Unless we start implementing all these four steps, we are in infodemic and there is no way of controlling this. And poor people who follow this without knowing what it is land up in trouble. Back to you, Jisha.
Yes, Dr. Kishore, and that's something that Nicola has been doing quite well. He has been actively offline as well as online trying to debunk a lot of medical misinformation. Nicola, is it something that you've always been comfortable doing for people who may be a little reluctant? They know the truth, but they think it's not their job to go up there and inform people. What would you like to tell?
My recipe was quite simple. I just tried to apply the guidelines of the WHO about RCCE, so risk communication and community engagement. And I simply, probably I'm quite skilled in communication. Probably I'm an empathic guy. I don't know, but it worked. I was be able to speak to the youngsters and to the elders, and what I really realized is that if you speak sincere, if you show that you do care about people, people do listen. They always do listen. I don't know if they do trust you at the end of the speech, but they do listen, and this is the first step. Another point, another important point is that when you approach people, well, science is reasonable. As a rational speaking is low, is quiet, while here people do like to scream. So when you see other people, you're in the other part start screaming, you have to quit the discussion. Otherwise, you lose because they are much more skilled than you in screaming, and you don't know how to do it. Say that if you are empathic, so in Italy, okay, well, in my local reality, empathic communication did the most part of it, and it worked. Last thing is that I also realized that when you have to debunk, you are late. You must monitor the situation and pre-bank and fill the void created with true, correct, empathic information, and with if you have time, your engagement to answer and to explain more with the with question and answer sessions. But this costs time and resources, and not all people, not all organizations have time and resources to do that. So it's quite difficult to say how to apply in a global situation. I can speak about my little reality, and in this little reality worked. About social, okay, about last thing about social communication with my personal Facebook page about not personal me about information on COVID-19. With just my resources, I reached 75,000 people. 75,000 people. Okay, for people who manage big data, it's nothing. But if you think that one single person can reach 75,000 people, it's quite a lot. So we can work a lot on this field, on this topic. Thank you.
Liz, we are in the business of communication, and we have been taught to. I thought Nicola made a very interesting point about when people are screaming. How do you still make your point in a civilized way? Because I think a lot of people don't want to get into the debate because they don't want it to get ugly and dirty. So, any tips or anything that you think has worked, or as an organization, any guidelines that you all have come up with, anything that you could give us?
Well, in terms of fact checking, there's only so much really we can do as journalists. It's so difficult to engage other people in a debate online. It's often a waste of time when you challenge people about their views, especially in an open debate where they they fear getting embarrassed and all that. So I think journalists do their job through fact checking. Um, Not really engaging in a debate online, fact checking and training, but you know, um, the work of fact checking and debunking, it has to be spread out. Everyone has to be doing it, not just journalists. Um, Journalists also have to do their jobs of looking for stories, unearthing investigations, and all that. So we need the help of everyone. We need the help of all citizens in debunking. So doing workshops with communities is a good idea. We go to community organizations, we give trainings, and we make them realize. Some of them don't really realize that you can fact check. You can challenge. You can check on Google. Google is it's a cheap, easy way to check, to fact check. Sometimes people don't realize it. And also critical thinking. More critical thinking workshops are needed um, to train people or to guide people on evaluating the messages that they get. Who said this? What do you think is the motive? Why? Where are they coming from? So these are the guidelines, or these are the things that people need to bear in mind when they receive messages about COVID. Back to you, Jisha.
I hear all of y'all talk about the importance of, say, evidence based communication and trust and empathy. So, here's something that I have been personally struggling with, and I know a lot of people that I communicate with confess to having this problem. Do you think it's harder to debunk misinformation or point out the inaccuracy of health related misinformation with family and friends or people in your closer circles? Or is it easier with them? And also, is it easier in person or is it easier on social media? Because I know that all of y'all come from different schools of thoughts. I thought it'd be interesting to hear different points of view on this. So, Dr. Nicola, if you could tell me, I know you do it quite effortlessly. Are you this effortless with your family and friends, or do they generally get you out of the group?
Well, no, family and friends. No, I have issues with family and friends because they tend not to trust you properly. Okay, well, we are Latins, so in our family, the eldest have a perception about the youngster, if even if I'm 50, okay, and so they look at me not as a doctor, but as the kid of yesterday, and so say, okay, yes, you have a degree, you are a doctor, you have a PhD, but you're still my nephew. So I'm older. I have seen much more life than you, so I don't trust you. And inside family, it's a problem to communicate. Outside family, if you can introduce yourself in a proper way, uh, they are they start to trust you. You need time, but they start to trust you more. You have to prove your credibility, but if you do it, they will they will listen and they will trust you in time. You need time, and you know that a serious disease like this is strictly time related. So it happens that you don't have time to do that. That's why I presume that the personal and professional credibility that should be one in a piece, you already have to you already have to get it before starting the communication. So people already do know you and know who you are, what you do, how clever you are in your profession, and also in your private life, in the small environment of your family-related friends. And so
Got
your
it. Dr.
word.
Nicola, there are many questions also coming in, and I want to answer those
Sorry.
questions that are from the audience for y'all, but I'll just give you a quick minute to respond to this, Sandra. How do you respond? Family more problematic, family friends, or you are just as at ease with all of them?
Okay, so I think it's also two-sided. Just like Dr. Nicola mentioned, there's some who will not trust you because of your position in the family. And then there are others who will trust you and believe you because they know of your background, that you've been working in the health sector. So probably what she's telling us is the truth. But generally, you'd find that trying to communicate with your family or your friends, they will try to judge you in terms of who you are or how much money you have, believe it or not. So sometimes you're influential because of the amount of money you have in your bank account. So if you're the poor one, people will not really listen to you. But if you're okay in terms of your economics are fine, you can provide us with something at the end of the day. If you're telling me to wear a mask, you're going to get me the mask, then Yeah, that's another scenario. But for me, I think it's been a bit easier because people will trust me because of my background. So yeah.
Liz, I can't imagine you people not taking you seriously. Whatever you say, I'm sure they take it seriously. But do you have any kind of insights on how perhaps we could approach this when you talk to people you know versus people you perhaps do not know?
I think that the key there is to not embarrass them and not to put them in a spot when talking to them. So let's say you're in a chat group, in a big chat group, it's going to be difficult to challenge or to fact check someone openly. So the better option would be to message the person and privately say, I saw this online and it seems that what you shared is false. As far as family is concerned, it also depends on the dynamic within families. So there are families that are really very close and they understand that these things are, meant for the good of the family. But if there are dynamics where, you hate one relative and you have a history, those things come into play. But so far, I think people really, especially now that they're aware of false information, they're really more open to being debunked.
Dr. Kishore, you don't seem to have that problem at all. I am told that you're the same with family and friends, with colleagues, with everybody. You say it as it is. Please tell us, how do we do it?
Yeah. No, no, that's not true. I mean, majority of the times, people do listen to you because you're reasonably senior and experienced. But it all comes down to the desperation. I'll give you a couple of examples to tell you. See, we had a distant family member who had a brain tumor called glioblastoma. And they called me after appropriate counseling to see what they can get. And I told them, this is your surgeon is right. You have 6 months to live and you may not survive for long. So these people went on fishing and they found one allied health professional who promised them the cure, only to realize that 6 months later this guy was dead. And they realized too late, but when they were desperate like that, they do listen to others. We had another family member who was 65, who had diabetes and complications. Somebody told them diabetes is related to sugar and not the sugar present in fruits, because the sugar present in fruits is fructose. So you can eat as much fruits as possible. So this guy went on eating mangoes and all sorts of fruits, landed up in more complications. And then he realized that guy was telling us not the truth. So sometimes it all depends on them experiencing, because the information they give or the misinformation they give is so powerful and people are desperate situations, they tend to listen to somebody else irrespective of what is your reputation in the family. Back to you, Jisha.
Okay, so I will come back to you for last round of questions, but before that, there are some very interesting questions that have come in from the audience. So I'm just going to pick a couple of them. Sandra, the first one is for you. It says, how can field epidemiology and specifically field epidemiology training programs contribute to building resilience to misinformation on social media?
Okay, so the good thing about field epidemiology program is that they've been there for a very long time, and AFNET has been supporting, I think, over 33 countries in the Afro region in terms of training field epidemiologists. So every year we have a bunch of people that are going into the field with training. So it's a platform that we can actually utilize to improve, because there's already a health promotion aspect that's in there where we talk about behavior change, we talk about communication strategies. So we can actually build on that and include the issues to do with misinformation in terms of focusing on social media. And it's also important that we as the epidemiologists are present within the social media network so that we actually know and understand what's happening, because I think it's a bit difficult to understand what's happening on Twitter if you're not there, and you can't really be in a position to listen to the conversations that are happening there. So you actually have to be present on social media for you to know what's happening there, and actually get the tools that you can make use of so that you can find out the trends, and this will come in during the training program. So I think it's an area that is a bit bleak because misinformation was not a big topic before COVID-19. So this is a chance for us to actually add a curriculum that focuses on that, and that actually talks about the social media and the importance of being IT or techno savvy in a certain way, so that you understand how to debunk and pre-bunk that misinformation.
It's interesting, Sandra, that you should bring about the topic about the human behavior. Because on social media, another thing that we find is most people are not out there to find the truth or the facts. They already have certain preconceived notions. So you're just looking at people who affirm that view. So there is already a bias. Is that something, is there a way that we could deal with this confirmation bias? Dr. Kishore, you speak about dealing with certain behaviors in human beings. So how do we deal with these inherent biases?
I think the accuracy of the information with the appropriate references and experiences has to be given. But you have to be very authentic and very convincing. If you are not authentic and convincing, especially with the so many allied health specialties like acupressure, Ayurvedic, homeopathic, you name it, people definitely take advantage because each one has a belief that their specialty is the best one to treat. And especially non communicable diseases, people know that non communicable diseases are not treatable like infectious disease. And when you say that when the medical professionals say this disease is for lifelong, suddenly the human behavior and tendency anywhere in the world start looking for alternatives. They said it's not curable. Let me find some cure. So it is the accuracy of the information and experience and symposiums like this will spread the news, and probably talking to people who have gone through the misinformation experience and suffered will probably go a long way to demyth the misinformation that is being spread. Back to you, Jisha.
Liz, there's a question for you from the audience. Uh, what are the things journalists need to do to improve fact checking in newsrooms?
Well, that's a difficult question, but there we're doing we're constantly having workshops on fact checking. So the skills and the applications are constantly evolving. So I think we need to be always on our toes on what's new. What are the misinformation spreaders doing? Where are they? What are the tools that they do? How do we check them? So we need to be aware of, and we need to be well versed in the tools. Um, and then we need to be able to identify who's behind it also, because much of the disinformation actually is an organized they're organized groups. Misinformation, we can say that these are unintended falsehoods that are being peddled by people who have probably nothing better to do, but they're also used by people with an agenda. So I think it needs journalists need to be aware. They need to read up. They need to be informed about this because it happens not just in our country but everywhere. And we need to be able to spot the trends. What are people in other places doing, and how can we make use of what they're doing? Back to you.
Right. So there is this question. This is a very good question, and I think it's open for all of y'all. Please take it. Has credibility issues of institutions like WHO, journalism outlet, vaccine companies, and government agencies also contributed to the spread of misinformation? Dr. Nicola, do you want to take that?
Oh yes, but of course I can speak about my reality. For my experience and I have evidence that my being a part, being a part of an independent fact-checking organization and being certified by WHO brought me a certain credibility. But being not inside the government establishment brought me much more credibility, because here people do not trust government. And so, if you are part of the government institution, they look at you in a suspicious way. It's an Italian nature, okay? It's not, but it is important to say that, because if you are independent, you have already start saying. You have no big pharma behind you. You have not the big power, the dark powers. You know, all the fake news and conspiracy theories that are running out. So you're just yourself, and people, and you can reach people much more in a much more easy way.
Right. Nicola, but I want to take that to Sandra, because Sandra has been nodding. And Sandra, do you also think that a lot of it has to do with the context as well? A lot of information is not given in context, perhaps, or in a language that the person you're communicating with understands completely. So, is that something that you all work on? Is there something that we can learn perhaps from your experiences in the African region?
Okay, so I was agreeing to the lack of trust within the government institutions, because I think that's also widespread within the Afro region as well. So if anything comes through the government, then it's a bit suspicious. But I think the one thing that we've been doing
I
wrong
think
over
that's
the years.
universal, Sandra.
Sorry?
I think that's universal, Sandra.
Oh yeah. So I think the one thing that we've been probably doing the wrong way over the years is providing generic information. That once COVID came, we were talking about the preventive measures. We're like telling people what to do. We're not really engaging with the communities or even engaging with the authorities at the end of the day, because that has a major impact. So it's very important that you listen to what the people want to hear. What are their concerns? What are their issues? And then you respond to those. So what we have tried to do within the Afro region through the Africa Infodemic Response Alliance. I'm sure you've heard about it. It's a combination of a lot of organizations that are working within the Afro region. And what we do is we combine our social listening trends that we've heard over the months or over the weeks. And every month we come out with a report that speaks to all the countries that are being worked on in the Afro region. So we then provide recommendations that speak to what we are hearing on social media and what we're hearing on offline as well, because we have organizations that are collecting information offline. So we kind of combine those issues that are coming around, the key trends, and then we share with the partners and we share with countries so that they also are in a position to hear what people are saying, the people that are in the countries are saying, and we provide recommendations as to what kind of messaging should you put across. So this has been useful because a lot of the countries are not capacitated to actually have that social listening to be done within their countries. So that level of support from the Afro region has been very useful in terms of providing recommendations on information and the messaging viewpoint. Over to you. Sure.
Yes, thank you, Sandra. As we are going to wrap up this panel discussion, I want to give each one of you all a moment to share with us your thoughts. Here's what I think while we are having this discussion today is that we have this moment where this medical misinformation is at the center stage. What do we do from now on? What do we do right now to seize this moment, a moment of learning and growth, so that we can build a resilience to this public health challenge at an individual, organizational, community, as well as national level? So each one of y'all, please let us know what are your thoughts on this? What can we do from now on in our own capacities, no matter who we are, what we do? Liz?
Well, in the Philippines, most people get their information from social media. The Filipinos are some of the top users of social media. So Facebook, YouTube, you have those kinds of sources of information. As a journalist, it's my obligation to debunk whatever I see and to encourage people I know to expand their horizon, to expand their sources of news. So I tell them, aside from social media, also read newspapers, also watch television news, also read books and magazines. But if they're stuck on social media, and especially stuck on messaging platforms like WhatsApp, Viber, etc., I also tell them to expand, look for other groups, and not just not be tribal and just look at one echo chamber, but to look for join other groups. That's it.
That's very sound advice, Loza. I like it. Don't be tribal, expand. Dr. Kishore, would you like to add to that?
Yes, Tisha. I think, as I mentioned earlier, this needs a multi-pronged approach, not just a single. First of all, the misinformation has been there for ages. The vaccination and the pandemic has brought it to light. I think seminars like this will make people are aware. But second thing is, I think every misinformation which is detected needs to be counteracted, and spreaders of the misinformation need to be taken into task and dealt appropriately. And that's the only way to deal with that, especially for diseases which are there is no cure or terminal. The amount of misinformation is leading to confusion and chaos, and it is affecting the health of a lot of individuals, especially as you mentioned in the beginning. The cancer areas are so much misinformation and disinformation. It is really affecting the care of many people, and many people are losing their life savings over such misinformation and disinformation. So it is high time we take a strong approach and say this is misinformation, and anybody who spreads the misinformation is dealt appropriately, legally, and ethically and morally. That is the only way we can put the stop to this. Thank you, Jisha.
Sandra, anything you'd like to add to that?
Just to say, let's make a lot of noise about infodemic management. It's a new field. We need a lot of buy-in from everyone. It's not just a health issue now. The politicians need to come on board. The religious leaders need to come on board. Everyone needs to be on board so that we can be able to manage the issue of misinformation and disinformation. Over.
That was just the way we wanted. Short and things that we will carry back with us. Nicola, we are giving you the last word.
Yeah, okay, thank you. I strongly believe in the Infodemic Managers Network about with WHO. We are starting creating a network of people from all over the world that can cooperate and run to help each other if needed. It's just started, but we can do a lot more, and it is very interesting and have great potential. I strongly believe that.
Thank you. Thank you so much. Thank you, everyone, for joining us today. I think while we all may have different strategies and ways of dealing with the problem, I think we all agree that misinformation pollutes our information environment and it is harmful to public health. So, together, we do have the power to build a healthier information environment. But unfortunately, it cannot be done by one individual, one organization, or one country. It will require a whole of society effort. That's the only way we are going to build a healthier, kinder, more evidence based, and connected world. Thank you so much for joining us today.